Hi, everybody. This is Dr. Eliana Aaron. It's April 13th, 2020, and I want to give you a few updates regarding what's going on right now in Israel. We're at day 53. I'm going to show you some charts. A couple of things have changed. The major cities that are having flare-ups are all on lockdown, and actually they want the whole country to be on lockdown from tomorrow midday until Thursday morning, which includes the whole holiday, and that's to prevent people from traveling and visiting other people. So that's going into effect, although the cities that are having the flare-ups right now, or the hotspots, they've been on lockdown already from noon today, straight through until the end of the holiday. And that may also be extended depending on how the numbers are. And unfortunately today, we have some numbers that are not looking great, so I want to discuss that. I'm going to go ahead and share my screen just to give you the update. Oh, the other two updates before I start with the numbers. Number one is new policy that for people who cannot afford medical care, all the hospitals will be treating people with corona and not require payment. So that's for people who are here in Israel who don't have insurance, don't have a status, such as some of the foreign workers, perhaps some of the migrant workers and tourists and other people who may not be able to cover hospital bills. The other news is that starting today, the government is distributing 300,000 reusable masks, 3 per, I'm not sure household or person, but I would imagine per person possibly, that are washable, that are being produced in Israel. They are sending them to the cities that are currently having these big outbreaks. So that's another measure that the government is taking. I'm going to go ahead and share my screen so you can see what's going on today. So what we have today is basically, you can see we have 11,586 cases today, which is an increase of about 440 cases. And the new cases is about 441, which, new cases 441. So that's been about the same pretty consistently for a few days already. That would be the first thing that although the total number of new cases seems to be pretty consistent, what we're seeing is that it's not going down. And so we're kind of stagnating where we are. I'm going to show you some other charts that are going to help show this a little bit better. And I'm going to show you the problem chart right now. That's not what I want to show you, but that's what I have to show you. And that's the epidemiology curve. And as you can see, normally when you have a curve, what you're going to see is that there are ups and downs, going up and going down. What we want to see, it's like a stock market, ups and downs. What we want to see is that the low points are higher going up and lower going down. The low points are lower going down than the previous low points. I mean, it's not perfectly even. We also want to see on the way down, which is where we were hoping we were going, is that the high points are lower at each level. So each time it goes down, it's not quite getting. So what you can see here is that this point here didn't get to this point here. This was related to the holiday, so that was kind of not a normal number, and probably ended up evening out at somewhere in the middle between the 8th and the 9th. But what we're seeing here is that this low that we got to here did not get below the average low, what we estimate was going on first day of Passover. So the question is, are we on an upswing? And is this all just a small bump into a larger picture? And that's really the danger that we have now, is we don't know, and it's guessing. But what I don't love is that this didn't continue to go down. And so with all the precautions that we're having, again, there's going to be a 2-week delay. So we saw this nice curve down happening after we were pretty much on lockdown, and we started seeing the effects. This is new cases per day. So the new cases go down once you have these really strict social distancing measures. But what we're seeing here is, we've now locked down a few of the hot spots going on for about a week. It will take another week until we see how that's affecting the national numbers. But right now, this is where we're at. It takes 2 weeks until that number stabilizes, and that's my concern. Going down to the percentage of new patients, you can see that, we were on a downturn, and what we're seeing here is that the percentage is pretty stable, but it's not going down. And so what we're seeing here is we're still less than 5%, but it's something to look out for, that we're not quite, strengthening the curve lowering that we wanted, even though our numbers are stabilizing. So it's just something to bear in mind that we're not out of the woods, unfortunately. Case fatality rate, Israel's now at 1%. We did have 11 deaths today, which is a lot for us. And that brought us up to 1% in the big picture. And I included a few other countries, such as South Korea, in here. But what you can see is that the international average is 6.21. And what you're seeing here is Israel's still, of the developed countries in the top numbers, Israel's still by far the safest country. Again, half the rate of South Korea, and we have less people. Doesn't matter. It's a percentage. So it doesn't make a difference, and that's why this is a nice number to look at, because it really does talk about how the country is managing these cases. So that to keep in mind. And basically, we have the last day of holiday coming up. The government really wants everyone staying home. You can't police everybody. My brother was stopped 3 times by police when he went to a pharmacy to pick up medicine today. So they are stopping people. They are issuing fines and tickets. And I don't want people going out and saying, well, maybe I won't get caught. We have to think in a national way. We have to think in terms of, is it worth my health, my life, the loved ones that I'm with in my home, my parents, my children? Is it worth everyone's life for me to go out? Is it worth it to go for that walk, and the jog that's well beyond 100 meters? Because we're seeing a lot of people doing it, and they're not doing it with masks. Masks are required. There's a reason why they're there. The reason why we wear masks is not to protect ourselves only, but to protect other people, because we don't really know if we have it. I go to the market, I wear a mask, I wear gloves, but I can still catch it because I am leaving my house and I have to buy milk, okay? So, and I'm not the only person. There's somebody in every household who has to leave and get things. So everyone has some level of exposure, no matter how hard you try not to. It's just the way it is. Groceries get delivered, you touch things, you don't wash your hands, you forget, it happens. So we need to protect each other, wearing the masks, keeping to 100 meters of our home, protecting ourselves, and monitoring how well we are keeping to these measures is important. If you see people who are actually violating the law, you have to call the police because they could be causing harm to other people. If you see that people are pushing the limits, say something. Say, listen, these rules are here to protect everybody. It's not about you. It's not about, oh, my glasses get fogged up when I wear the mask. It's about everybody being together and united to fight this virus and to protect our neighbors, our families, our communities, and our country, and our world. Please stay safe, stay healthy, and please stay home. Take care.